One question that's often asked is how HIV can be the cause of 30 different diseases. It wasn't always that way. Back in the early 1980s, gay-related immune deficiency, which became AIDS, was just 2 different diseases. It was PCP pneumonia and Kaposi's sarcoma, a kind of skin cancer. But over the years, up until 1993, the Centers for Disease Control kept expanding the definition of AIDS until it reached 30 different diseases, some infections, some cancers. They have the strange attribute that if you test positive for HIV and you have tuberculosis, it's called AIDS. But if you have tuberculosis and you're negative for HIV, it's just tuberculosis. And worse yet, in 1993, they changed the definition of AIDS so that if you had a low CD4 immune cell count as well as a positive HIV test, even though you had no diseases at all, you would become an AIDS patient. And by 1997, almost 2/3 of new AIDS diagnoses were in people who had no disease, just a low immune cell count and a positive HIV test. It's probably far more people today, but the CDC stopped producing that statistic in 1997. There is a big push on nowadays to have everyone tested for HIV, and in some situations even mandatory testing. The problem with testing a low-risk population for any disease is that the accuracy of the test drops tremendously. Let's imagine that you had 1 out of 1,000 people who were really HIV positive, and you had a test that was 99.9% accurate. What that would mean is that you would have 1 out of 1,000 true positive test results, 1 out of 1,000 false positive. So even with a test that's 99.9% accurate, you will have 50% false positive test results. A lot of people in North America are going to be diagnosed with HIV. They're going to go on to the drugs because they're terrorized. It's a horrible situation. There's no way to distinguish between a true positive HIV test and a false positive. Many people ask why an antibody test is used to detect HIV and not something more direct. An antibody test merely looks for a reaction of your body to a former connection between you and the virus, a former infection that may have occurred or some other close contact with the virus. HIV tests should be based on actual proof that the virus is present, not on evidence that the virus may have been around sometime in the past. There are HIV tests that are a little bit more direct than antibody tests, but when those are negative and the antibody test is positive, it's usually assumed, it's always assumed, that you are actually infected with the virus. There are no tests that are true proof of the presence of the virus. In fact, worse than that, there's never been any purification of the virus. There truly is no proof that HIV exists. The drugs used to treat AIDS are extremely dangerous. The first drug was known as AZT, was approved in 1987. It stops DNA synthesis. Once AZT is in a cell, it latches on to a growing chain of DNA and it terminates DNA synthesis. So it's a little bit like cancer drugs. In fact, AZT is a failed cancer drug. It attacks all living cells, all dividing cells, and perhaps the greatest tragedy of the use of AIDS drugs is the fact that they give AZT to pregnant women. So women whose fetus is, of course, dividing at an extremely rapid rate are exposed to a drug that directly interferes with cell division. These drugs, called nucleoside analogs, of which AZT was only the first of a number of these drugs, are still in use. In fact, AZT is still found in a large number of combination therapies, even though the name itself is not used. There's a drug called Combivir, for example, which includes AZT in combination with 3-TC, which is another nucleoside analog. So in one pill, you're actually getting 2 drugs that interfere with DNA synthesis. In the mid-1990s, they came out with new drugs called protease inhibitors, which were supposed to be less toxic and more effective. But within a very short time, it was determined that protease inhibitors seriously interfered with metabolism in the body, causing skyrocketing cholesterol rates, fat redistribution around the body, liver disorders, liver failure, heart disease, heart attacks. All kinds of metabolic problems were caused by the protease inhibitors. All AIDS drugs are dangerous. All of them have fatal side effects. One of the reasons many people believe that HIV causes AIDS is because so many educated and important people claim that HIV does cause AIDS, that claim that the proof is present. Is it possible for the majority of scientists in a particular area to be wrong? There are precedents for this in the past, many precedents actually. One really good example was the Piltdown Man, a skull found in around 1913 in England that was believed to be the missing link between man and ape. For 50 years, scientists believed that this was a legitimate skull, and it was only when one young scientist drilled a hole in the skull — it was very difficult to get access to it — when he drilled a hole in the skull, he found white bone underneath. In other words, it was a crude fake. But it took 50 years because the power of the top scientists had protected the skull from investigation. Another example from the same era was an Austrian meteorologist named Alfred Wegener, who claimed in 1913 that the continents were moving around the Earth. He was ridiculed, and for about 50 years, geologists believed that the continents were static. And in fact, if you talked about continental drift in a geology department, you would probably lose your job. In both of those cases, for 50 years, an entire branch of science had it wrong. And one of the reasons why they all had it wrong is because science is a group effort. It's extremely hierarchical. When people like Robert Gallo, Tony Fauci, David Baltimore say that HIV is the cause of AIDS, you know that your career is on the line. And if you're a young scientist and you maybe have a few questions, and you ask those questions, and you get put back in your place, and it's made clear to you that your career will be over, if you even talk about Peter Duesberg, or you even talk about the Perth group, or you even talk about whether HIV causes AIDS, if you have any questions at all, your career is over. Peter Duesberg is a classic example. In 1987, he published one paper in the prestigious journal Cancer Research claiming that HIV could not cause AIDS. He had never had a grant turned down before that date. After that date, he never had a grant from the government given to him again. His right to publish was totally destroyed. Before 1987, journals were falling over themselves to publish his articles. After 1987, he had difficulty publishing, even in journals where he had the right to publish. One of the things that happens when people are diagnosed with HIV is they're given by their doctor a death sentence. And in many cases, people accept that. In primitive societies, if you did something wrong, maybe you committed murder or some other serious crime, the local witch doctor would cast you out of the village, maybe with a spell. And in some societies, they pointed a bone at you. You would go away and die. And the reason is because you believed in the power of the person who had cursed you. In our modern society, it's doctors who have the power to curse. If they tell you that you have a fatal disease, that you will die, you, of course, beg for their mercy. You say, what do I need to do? And then they tell you, you need to go on to these drugs. It's your only chance. You go on to the drugs, you get sicker and sicker, and the doctor tells you the reason you're getting sicker is because of the AIDS. And just think how much sicker you would have been if I hadn't given you these drugs. It seems a little hard to believe, but we have so much faith in our medical system that people do actually swallow that line. And even though they do get sick, often for the first time after they take AIDS drugs, they believe so strongly in the theory that they cannot see the inconsistencies. They cannot see that the reason they are sick is because they're taking the drugs. There was a recent paper at a conference a couple of years ago that said that the biggest reason for people who are HIV positive to die nowadays is liver failure. Liver failure is not an AIDS-defining condition. Liver failure is, however, a common side effect of AIDS drugs. All AIDS drugs.